These twins were born at this health centre in Pakistan's Nowshera district just 8 days ago. Their mother doesn't have enough to eat and can't produce enough breast milk to feed them. 800 people are being cared for here every day, but supplies of food and medicine are starting to run low.
The nurses helped my wife with the birth, but they need milk. They're too thin. They're babies, and they need medicine and vitamins, but they're getting virtually nothing.
From gastroenteritis to diarrhoea and skin infections, the patients all have similar complaints. For now, the medical team's focusing on the most vulnerable, children in particular. After the floodwaters came, many of them contracted viruses. ANIA spent several hours waist-high in dirty water with her young daughter in her arms.
She's been ill for several days. She's always crying. She's getting treatment, but it's not working. She's still got stomachache.
For children, especially newborns, diarrhoea is a potential killer.
Some of the children vomit 10 times a day, more than that, and we transfer them to hospital. They have to be treated quickly, as there's a risk of dehydration and consequently death.
Around 5 million people live in Nowshera, a large proportion of them in rural areas. They've been hardest hit by the floods. The damage here is widespread. In 2 weeks the academic year is due to begin, though many schools such as this one have been destroyed. AISHA is 11 years old and her family lost everything.
I miss my books and my Quran a lot. I love studying, but my school was destroyed. I don't know what we're going to do. I don't want to stay here.
According to UNICEF, 6 million children have been affected by the floods, and in such catastrophic conditions, it's hard for parents to keep watch over them. Amid the stagnant water and debris, these young children are searching for their toys. As the region struggles to cope with its worst floods in 80 years, illness and infection are now the major threat.